Hi, my name is Molly. I'm the project manager at SJB Clinic. Don't mind me, I'm just at the park. I'm recording our little orientation video. Hopefully you're watching this before your first time at clinic. I just wanted to make this so that you have an idea of what happens, the background of the SJB patients, and how clinic works before you get there, because I know it's really overwhelming when you arrive and you have me talking to you forever and then you gotta rush into patient care. So we're just trying to do this little by little so you have an idea of what it is like to volunteer at SJB. So at SJB Clinic we have our patients who qualify to be seen in a couple of ways. So there's a daytime clinic that's called SJB Clinic. Our nighttime is our specialty clinic where we rotate 8 different specialties, and it's our student-run clinic associated with Docs Med School. And the Department of Community Service basically supports us, and I, along with 4 other staff members, run the clinic during the year. So it's fully student run, and then we also work along with the executive director of SJB Clinic and the supervisor for the day clinic, since we use their resources and we talk about what other resources we found for our patients and whatnot. But anyway, so the day clinic does the registration for the clinic, for the patients, sorry. They register the patients, and patients can qualify. There are 2 conditions. So 1, the patient has to be uninsured. 2, the patient has to be less than 200% of the federal poverty level. And basically what that means is that the patient has to have an income less than a certain amount. Their salary is less than whatever the federal government sets each year for the number of people in their household. So for example, like a 1-person household, if the person earns a little less, so $12,000 is around the 1-person household federal poverty level line. So twice that, the patient has to earn less than twice that. So it would be around $24,000 for 1 person. They need to earn less than that, all of our patients would. And then for a 4-person household, the amount is about $24,000. You double that, so the patient, the 200% below the federal poverty level for a 4-person household would be about $24,000. Anyways, our patients don't really have the resources to pay for healthcare like you or I might have access to. So like I said, less than 200% of the federal poverty level, and then also patients have to be uninsured. So the patient does not necessarily have to be a citizen, but they have to be uninsured and earn less than 200% of the federal poverty level. So I'm going to be talking about in this video a little bit about the resources that we utilize to help our patients get everything that they may need. So like I mentioned, there's a daytime clinic at SJB. There's primary care for these patients. Most of these patients all of them would be referred from their primary care, either physician or nurse practitioner. And then our 8 different specialties, I may forget 1 or 2, but I'll go for it. So we have pulmonology, neurology, psychiatry, internal medicine, gastroenterology, urology, and then PM&R, physical medicine and rehabilitation, and rheumatology, and then I think that's it. And cardiology, that's the last one. So those are 8 specialties, and we rotate every Tuesday night. So patients, we schedule about 17 to 19 patients per night, and we usually get anywhere from, I don't know, 6 at our lowest to 15 or 16 patients showing up. So it really depends how many patients you'll see, depending on how many patients show up. And Marta, who I'll be talking about later, is our biggest helper. She works at the daytime clinic, and then she's our main SJB clinic guru at night. She helps us schedule our patients, make sure they have all their forms that they need for their appointments. She calls patients to remind them. So she does call all of the patients to remind them and to see if they need to cancel, but we still get a lot of patient no-shows. We've done some various surveys in the past, and the reasons vary, of course, with transportation, weather, work, and whatnot. But yeah, so anyways, you will be, if this is your first time, we have 6 different rooms where we see patients, and these 6 different rooms will have 3 people in each room. You'll have an upperclassman, a Spanish-speaking interpreter, who should be trained, hopefully. We do a training for all of them, and then an upperclassman, so either a 3rd or 4th year. And each person in the room will have a very important role. So the underclassmen, the 1st or 2nd year, will be taking the interview and leading the interview. And the interpreter will be kind of like the patient advocate. Of course, they're interpreting, translating from Spanish to English, English to Spanish, but they're also letting the patient know how everything works at the clinic, what they should expect, that they're going to have to pause multiple times while they're speaking to translate into English, and that the patient shouldn't worry about that, that the student team will have to leave the room to go speak with to present to the attending and speak with them, and then we'll return with the physician. So the interpreter is doing a lot, so definitely appreciate them. The upperclassman is typing the note on the computer, so they're working with the EMR. EMR is Practice Fusion. It's a free EMR, and all of them hopefully have the training for that. And the upperclassmen are also helping with the interview a little bit if the underclassman's struggling or isn't hitting all of the questions that maybe they should. And then, of course, the upperclassmen are helping with like the student education component. Normally we do a student education session at the beginning of every SJB clinic night, so that everyone has an idea of what we are going to, kind of the sort of, I don't know, illnesses that we'll be looking at that night. So again, there's 3 people in each room, so you're working with a team, you're not working by yourself. You all will be seeing 1 patient, possibly 2, maybe even 3. And there's 6 rooms total, so you guys are all working. Okay, so now to the physician component. So the physicians usually arrive around 6:15. So normally you'll start your interview around 5:30, so that should give you around 45 minutes to do the interview and the physical exam, which should be sufficient for you. Of course, the patients differ in complexity, and sometimes we have new patients which take longer and follow-up patients which don't take as long. So we have a mix of what you will be seeing. And but basically my point is just try and be ready as close to 6:15 as possible to present to a physician. We usually have about 4 physicians total each night. We'll get attendings, residents, fellows, depending on the specialty, depending on the number of patients we expect to show. Some of the nights are combined specialties, so you may be at like a neurology, pulmonology night, and so we'll have both neurologists and pulmonologists, and I'll basically match you with the physician that you will present to. So in my email, you should have seen a little presentation guideline, an outline, so you can review that if you've never presented before, or just if you want to refer to it. But it's a typical presentation outline. The upperclassmen should be able to help guide you. Hopefully you'll have time to practice a couple minutes your presentation after walking out of the room with a patient and before you present to the physician. Sometimes if there are a lot of physicians waiting, I may ask you to not take as much time, or just take like a minute to gather your notes and then present, because we have to keep the workflow going in the clinic. I'll go ahead and mention now that we some students completed a needs assessment back in they finished it let's say in around January, February of 2017. So, and what they found was the biggest complaint at the night SJB clinic is that patients have had to wait too long, and then they end up leaving the clinic late at night, taking public transportation and don't feel comfortable, etc., etc. So we want to optimize the patient experience and the student learning experience and try and find the balance between letting you guys learn and then also doing what's best for the patients, of course. So please try to be as efficient as possible in your questioning, interviews, and presentations. Of course, I'm sure you probably will find that tomorrow we always have plenty of snacks and food in the kitchen, so you can take little breaks and do that. But please be efficient and when you're snacking and taking breaks and whatnot. Okay, so the next thing is, like I mentioned, try and be ready by 6:15 for physicians to present. If we have a lot of physicians waiting and you haven't finished or wrapped up your interview, I might knock on your door just to see, how the interview is going. At what point are you in your interview? Are you at the physical exam? Are you wrapping up your interview? Or maybe you're just not even close to wrapping up the interview. So that knock is kind of me asking what's going on, and then also means that you might need to hurry it up a little bit. So that's that. I don't have my binders with me right now, but in another video I'll explain what each of the forms are for labs, for diagnostics, and then I'll do some specialty specific videos. So basically we have a binder in each room that I'll show you in another video, and this binder is very useful. It has examples of all the forms correctly completed, and then it has the blank forms. So I'm just gonna go over some of the things you might be ordering on any particular night, but one of the most important things is that we want our care to be as low cost for the patients as possible without jeopardizing what they need. What I mean by that is we have access to free labs and free diagnostics at Baptist, which is really, really awesome. Basically, SJB Clinic has an agreement, like an unwritten agreement with Baptist, and we're able to get labs and diagnostics for free for SJB Clinic patients. So what that means is just basically if you need any lab or diagnostic, you want to order at Baptist, because our other option is Jackson, which is our big safety net hospital in Miami. And Jackson is wonderful because it provides a lot of options for patients who might not otherwise be able to get care. But to be seen at Jackson, you need a Jackson card, which some of you may heard of, some of you may not have, but basically the Jackson card, in order to get one, you have to have kind of an intensive financial assessment, and you have to have a lot of papers. What I mean by papers is like copies of billing, statements, electrical bills, etc., showing that you've lived in Miami for, I believe, 6 months is what it is, and then at least 6 months, and then you have to be able to show these papers. And for a lot of patients, it's difficult to know exactly what they need to have and to get those papers together and to have everything they need on their one financial assessment appointment. So SJB Clinic during the daytime has someone named Sandra, and she's awesome. She basically is SJB's financial assessment Jackson person, that someone who needs a Jackson card will be able to meet with her, and she will tell them everything they need to have together, all of their papers and whatnot, before they have their official Jackson appointment. So Sandra is very helpful, and if you have a patient that needs to be referred to Jackson for anything, please, 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 if you take anything out of this video, let a staff member know So either myself, Vanessa, Anise, Daniel, or Stephanie, or whoever's on staff when you're volunteering at SJB Clinic. Basically, the reason why is because we need to give out Sandra's business card with some information about the documents needed for Jackson card. There's a little packet in your binder. It's pretty thick. We need to give out that. We need to do an electronic referral and make sure that it is done properly and to the right department that needs to be seen, that the patient needs to be seen at Jackson. And then we also need to fill out a little form. It's like a half page in there that says why the patient needs to be seen at Jackson and whatnot. And we're gonna Vanessa will put that information in our computer, our box Excel sheet, and basically we're going to follow the patient, and Daniel, our patient liaison, will help us make sure that the patient is seen by Sandra, who's going to help them gather their documents. And then if for some reason none of this happens, then Daniel will be able to follow up on it and see why the patient hasn't been able to get their Jackson card. So, and then for some specific tests that you're ordering, for example, like a stress test or a colonoscopy, we have like a 1-page form that needs to be filled out that is not in your binder. And so anyways, there's just a lot to do for Jackson cards. So if you're referring to Jackson, ask the patient if they have a Jackson card. Ask a staff member to help you, and if the patient has a Jackson card, make sure it's not expired, because that's one of the biggest things. Jackson cards expire every 6 months, so it's bad. I mean, if the patients show up to their appointment and they have a Jackson card, great, but it's expired, then it's useless. So anyways, find a staff member who can help you out. Sorry about the airplane near the airport, but find a staff member that can help you out, and we will make sure that the Jackson referral is hopefully done right. Patients, like I said, who have a Jackson card, we need to check to make sure it's not expired. And also we need to make a copy of the Jackson card if there already is not one in the Practice Fusion EMR. So if you have questions about this, please let us know. I know there's a lot to remember, but if you're doing Jackson referral, let a staff member know. Now, to be seen at Jackson, it is maybe cheaper than if you were seeing it like private practice and you're cash paying, but there's still a cost to be seen at Jackson. It's a sliding scale. So for any patient that can get something done at Baptist, like we said, it's free, which is awesome. So get it done at Baptist. If it can't be done at Baptist, then we go through the Jackson process and help the patient navigate what they need to do. Okay, so now we'll go ahead and talk about medications. So you will probably at some point in your time volunteering prescribe a medication. Now, we do not do e-prescriptions, so we do paper pads prescriptions, and I will show you in another video, but there are 2 different pads. So there's one that's a slightly like light blue grayish color, and it's for controlled scripts. The other one is a completely white pad, and that's for any non-controlled scripts. So please make sure you're using the right script pad. Hopefully your upperclassmen and attending physicians will be mindful of that, but make sure you are as well. If you're not sure if a medication is controlled, you can look it up on the internet. That's what the computers are for. In terms of finding the cheapest medications, we have 3 different options. So hopefully you catch all of this, but we'll remind you if you don't remember, just remember to ask us. So one really handy website for all of your patients is called goodrx.com. GoodRx, you can type in the name of the medication, change the dosing, the like capsule or tablet, how many days supply you want, and it tells you the cheapest place to get it at. So like Target versus Walmart or whatnot. The only caveat is that there are coupons that you have to print out. So there are printers in every room you should be able to print out. Just make sure that the patient has 1 coupon for every refill, right? So they're gonna need 1 coupon for every refill. And yeah, so that's goodrx.com. So the patient will have to pay for the medication, and hopefully they'll get a discount and the medication at the cheapest location. Now, if the patient is on something that like a blood pressure medication or something for BPH, and they're going to be on it for a long time or at least a year, it is a great option we can help the patient apply for what's called the patient assistance program. And basically what this is the patient applies and to get a year's supply of the medication for free. So we have this option, and either I or probably Vanessa, who's our logistics coordinator, she is going to help you sign the patient up, print out the form, and then we'll get the patient to sign it, the physician to sign it, and we'll get a script for it, a year's supply, and then we'll leave it for Sandra, who helps the patients with their Jackson referrals, but also on the patient assistance program. So please let us know if you think your patient would apply and benefit from the patient assistance program, and we can see if we can get them that drug. The thing is that they will not get the medication right away. It might take a while, so they might have to pay for like 1 or 2 months of the medication by themselves to get at the pharmacy until they get that year's supply. Our last option is just basically samples of medications. We have free samples of medications for patients, and we have them in the clinic, so you can ask me if we have a free sample of the medication that you need for your patient. Basically, I will sign the medication out, so that's why you need to let me know, please, that you're gonna need a sample, and I'll bring it out for you. I'll sign it out. I have to put down the lot number, the expiration date, and everything like that. And then you don't need a prescription, and we give it to the patient, and they should be good to go. So that's really good for some of the medications like Nexium. We usually have a lot of Nexium. Some of the pulmonology, like inhalers that are very expensive, we usually have some of those in stock. But it really depends. So just ask me, but we can't necessarily depend on having that free sample for the patient for every medication need that they might have. So keep that in mind. Again, you have 3 options for cheaper medications. You have the samples that we just went over, the patient assistance program, and goodrx.com. So make sure you utilize those for the patients so we can get them the cheapest prescriptions, and just, of course, communicate to them, okay, this is where you're going to be able to get your medication the cheapest. Is there one of these, like a Target near your house, or what's better for you, like a Winn-Dixie or a CVS, that sort of thing. Okay, so that's the medications. Next thing is all of these forms you're filling out, we have to get copies of, and we basically scan them into the EMR. So we're gonna need copies of your lab forms, your diagnostic forms, any, like I said, Jackson card, prescription. So Vanessa, again, she's your go-to person. She's gonna help you out with that. I can also make a copy for you and then hand it off to Vanessa, whoever's available. So that is how you're gonna do that. Copies of everything, and then at the end of your visit, so I'll start from the beginning, you're gonna call your patient back after you review the chart efficiently, right? And then you're going to interview the patient, perform the physical exam, and then present to the attending, go back in the room with the attending or physician or whoever is seeing the patient, and then once you explain the plan and everything, you're walking the patient up to the front desk so they can check out. At least one person in the group has to walk the patient to the front desk to see Marta. I mentioned her in the beginning, and she, again, is our go-to person. She's making the next patient appointment, so she is critical to speak with. So the reason why you need to go up to the front desk to speak with Marta is because the patient is probably not going to remember what happened in that room, even though you are going to write, there's a half sheet in the binder I'll show you later, where you write the patient plan, when you need their next appointment, etc., etc. So they should have that, but they're not going to remember everything. So Marta may ask you questions. Oh, is this patient going to get labs done? And you're like, oh yes. And she says, okay, I need both the copies of the lab order form so I can fax it. She's the one who faxes the form to Baptist so that so Baptist can call the patient with an appointment. So anyways, in summary, please walk one person in your group, walk the patient to Marta, and then she'll check the patient out. Even if the patient doesn't need a follow-up appointment, walk the patient to Marta's desk so that she knows they're leaving the clinic, because she keeps track of who's in the clinic, who's not in the clinic. Okay, so next thing, I mentioned that, okay, we might have to make the patient a follow-up appointment. So at the beginning, when all of you guys arrive, I'll make sure to look up the next available appointment for that specialty. This is really important because often the patient can't get an appointment for 4 or 5 months, and maybe you want them to be seen right away, or maybe you don't want them to be seen for another 6 months or a year. But basically, sorry about the airplane. Make sure that you speak with the physician that's seeing the patient and ask them, when does the patient need to be followed up. If they need to be followed up right away, like as soon as possible, let's say they have really uncontrolled blood pressure, they need to see a cardiologist or a physician in the near future, the best option is to make them the next available cardiology appointment, and then we can send a note to the primary care provider and have them monitor the blood pressure, or have the patient, we can also have our patient liaison, Daniel, he can text the patient, ask them how their blood pressure's been, if they've had any side effects of the medication like hypotension or whatever. So if you want to follow up on the patient either through primary care or through Daniel, our patient liaison, please let us know. And basically we're going to fill out one of those half sheets in the binder. It's yellow. It's called a patient case management note. This is a lot, I know, I'm sorry. So patient case management note, and you're just going to write like what you're concerned about with the patient, how often you want them to be followed up on, etc. And we'll put that in our system and we'll make sure to follow up with the patient, okay? Okay, so anyways, next available appointments. If the patient does not need to be seen by the specialty again, meaning they can be like discharged from the specialty and they can follow up with primary care, then that's awesome, because then the patient doesn't need the specialty care. We don't need to take up appointments if the patient doesn't need to be seen, right? So clarify with the physician if the patient can be discharged from the specialty. Now, if you're ordering any sort of labs, diagnostics, I don't know, anything like that, if you're ordering any test, it needs to be followed up on with the specialist or the ordering physician. So what I mean by that is if you're ordering like a CMP and a CBC on the patient, you can't say, oh, the patient can be discharged from urology, they can follow up on this lab with primary care, because primary care wants to make sure the specialist doesn't want to do anything else. So anyways, if you're ordering anything, can't be discharged from specialty care. Now, like I mentioned earlier on, we do have internal medicine care about every 4 weeks for our patients, and these patients are, this is their primary care at night. So we do have like a primary care clinic every couple weeks, but we only have a couple of patients that usually come. So that is their primary care, but for the rest of the patients, their primary care is during the daytime, separate from our student run clinic. So anyways, make sure you clarify follow-up when the patient needs to follow up and you get the appropriate appointment. So if the physician says not for another year, then wait another year or 6 months or whatever. We don't want to make unnecessary appointments. Okay, so that is pretty much all I have for now. I'm going to make another video in regards to the binder and then specialty specific topics. So hopefully this wasn't too long, and if you tried listening to me on 2 times speed, hopefully it wasn't too overwhelming. But again, always ask our staff for any questions. We just want to make sure that you guys have a pleasant learning experience and that the patient care, the quality of care is upheld. Anyways, thank you for volunteering, and we look forward to having you.